After watching her mom suffer with a rare disease, a young woman learns she shares the same diagnosis, but that doesn't mean she'll share the same fate. Good morning. I'm Alexis Del Cid in for Jessica Lovell. Welcome to the Morning Medical Update. Today we're going to learn more about that rare disease. It's called Moya Moya and what it does to the brain's blood vessels, plus the treatment that involves creating new holes in a patient's skull. But first we want to get to our COVID count. We were hoping to avoid an uptick, but unfortunately the numbers have jumped. Dr. Dana Hawkinson joins us remotely. Dr. Hawkinson, you're joining us from our location in Olathe because you're treating patients there today. What's the update?
Yeah, I'll be out here for the next couple weeks, and our infectious disease division is currently seeing patients out here because of the affiliation with the health system, and it's really good. It's been fun. I was out here a few weeks ago, and it's really good to be able to treat these patients and be seeing them. So I think we're all happy to be doing that. As far as COVID goes, in the health system, we do have 33 active patients. So there has been an uptick, unfortunately, just as you said. And I think the last time we had numbers like this for active COVID patients in the hospital was in March. So quite a few months ago. And I think we also have 7 ICU patients. So again, respiratory viral season is in full swing, and the virus is out there circulating. So everybody, please take note, take caution, and continue to do those things to prepare yourself and make yourself as healthy as you can be, especially as we have the holidays coming up.
And do you think that's probably what's behind this, is that people are starting to gather indoors for these holiday parties?
I think that's one thing. Again, we are a couple weeks removed from Thanksgiving, when there was a lot of travel, there was a lot of getting together. Mm-hmm. And we know it takes a little bit of time for that virus to infect one person, then infect 2, then 4, and so on. And so I think we are seeing some of the effects of that for sure.
I have a question for you about variants, because we know there are several different COVID variants and then subvariants. By the time the new COVID vaccine came out, in fact, there was a new variant that became dominant. Can you talk a little bit, though, about some new research? Because the research shows that the new vaccine can neutralize many different variants and not just the one it was designed for.
Yeah, I think that's a good point. So there was a Time article, and they were referencing a preprint of an article that looked at the immune response of the new COVID vaccine to certain variants. And what that showed was that as far as antibodies go, your body does develop antibodies to the new variants, even though that COVID vaccine is only towards one of the subvariants. Your body is able to react and evolve and develop antibody reactions or antibodies to even variants we haven't even seen. And that's one of the beautiful things about the immune system. And this was a preprint, and this was out of a lab by David Ho, who has done a lot of, he is a world-renowned researcher, but it was a very good lab. And his lab has been looking at this really since the vaccine came out. So very good, strong track record of data to support these findings. And I think we also have to understand that it's not just about the antibodies, but it is about those T cells as well. This particular report really just looked at the antibodies, but what it showed is that with the new updated vaccine, you can still develop neutralizing antibodies to the variants that are circulating at this time. And so I think that is one more reason that you should use to tip in the favor in your decision-making of getting the vaccine at this point.
So when it comes to the vaccine, the CDC says only 16% of adults in the U.S. have gotten the new COVID vaccine. Is that concerning for you?
It's very concerning. I think what we see as time goes on, and this has been with all of the vaccine updates, is that for those at risk, especially higher risk, getting that updated vaccine does help reduce your chance of going to the hospital and going to the ICU. And that is really what we want. We really want to reduce your risk of hospitalization and severe disease, and this vaccine does do that.
Dr. Hawkinson, thanks for joining us. We know you're looking forward to being at the Olathe location today, so I hope you have a great day.
Absolutely.
We'll see you when you're back here.
Okay.
Now back to our topic of Moya Moya. When Nerissa Elrod had her first seizure, she already had an idea of what might have caused it. Janine Kiesling shows us how Nerissa had to push, though, to finally get diagnosed with Moya Moya disease.
This rare disease can cause strokes in children as young as 5 years old. Its effects are terrifying. After watching her mother's suffering and ultimately her death, Nerissa Elrod feared the same fate and stopped thinking of a future until now. At just 10 years old, Nerissa Elrod lost her mother to a rare disease. Nerissa remembers how much her mom suffered as doctors struggled to diagnose her for years.
No one knew what it was, so she was having strokes and stuff like that. She couldn't speak very well. She couldn't walk very well. It was very bad.
2 years before her death, doctors determined Nerissa's mom had Moya Moya, a disease that causes the arteries in the brain to constrict, blocking blood flow and causing blood clots.
Moya Moya comes from the Japanese words for puff of smoke. It involves just a slow, gradual occlusion of the carotid arteries, sometimes both carotid arteries.
And at the time, not a whole lot of people knew what it was.
There was a doctor in California who had some success treating Moya Moya patients with surgery, so Nerissa's family headed out west. Unfortunately, the damage was too severe, and Nerissa's mom died shortly after the operation.
She was funny, ornery, just a great person. She liked to have fun.
By the time Nerissa was 15 years old, she started having what she called passing out spells. Doctors have since determined Nerissa was having TIAs, or mini strokes. Nerissa didn't want to believe the disease that took her mother was now threatening her life.
I feel like deep down I kind of knew, but it wasn't, I was a kid, so what do you say?
But when Nerissa had a grand mal seizure a few years ago, she could no longer deny what was happening. Like her mother, she too had Moya Moya. And like her mother, she was diagnosed at just 27 years old. Nerissa's journey, however, would take a different path. Instead of a trip to California, her doctor sent her to the University of Kansas Health System, where doctors had a plan to stop Nerissa from suffering the same fate as her mother.
We plug the blood vessel from the scalp, we make a hole in the skull and plug it directly in to one of the blood vessels on the surface of her brain, so it immediately starts bringing blood in.
He definitely gave me confidence because I trusted him.
Nerissa just had her second successful surgery. For the first time in years, she's looking forward to turning 30 and planning for a future her mother never had.
I want to go to cosmetology school. I've been putting that off for so long. It's really just time to get charge of life and get back and live again.
Nerissa joins us from her home in Northeast Kansas. Nerissa, good morning.
Good morning.
I just want to say, I don't know if you notice it when you look in the mirror or if everyone already tells you this, you look just like your mom in those pictures. You're basically your mom with straight hair.
Yes, I get that a lot. Thank you.
I bet that feels good when you hear that.
It does.
Thank you for sharing your story with us and sharing about your mom. We also have someone very special to you in the studio with us, Dr. Paul Camarada. We just saw you in the story. Dr. Camarada is the neurosurgeon and clinical service chief of neurosurgery here at the University of Kansas Health System. Dr. Camarada, Moya Moya is very rare. You see it, though, all the time. So why is it that you treat all these very rare cases?
Well, thanks, Alexis. We're a tertiary care referral center, so we get referrals from all over the Midwest. We have a number of physicians here in our department that specialize specifically in cerebrovascular operations. That's operations on blood vessels of the brain. They've had special training after a normal 7-year neurosurgical residency to be able to spend another year or two doing these fine microsurgeries to help Moya Moya.
The specific kind of surgery that you
Correct.
do is the microsurgery?
Yes, yeah, there are a number of surgical procedures. Nerissa received one particular called a direct bypass on both sides, but pretty much anything you do to expose the brain to blood vessels from outside will help. I mean, it will promote ingrowth of blood vessels from the surface.
So interesting, and we're going to get more to that surgery. We actually have an incredible video to show our audience. I want to ask Nerissa a question. It's been about 9 months since your brain surgery. Nerissa, it was actually the second of 2 brain operations. You had one on each side. How are you feeling today?
I feel amazing. Like, I feel really good and blessed.
How far apart was each surgery, time-wise?
I want to say, I believe it was 6 months.
Okay. So 6-month wait, and then you go back and do it again. Your mom had Moya Moya as well. You were only 10, and here are some of the pictures of your amazing mom. You were just 10 when she passed away. I want to ask you what you remember a lot about your mom. You said she was ornery, and you loved that about her. How did the Moya Moya affect her that you saw when you were 10 years old?
Well, a lot was, she wasn't able to really speak. She could say very few words, and she wasn't able to walk very much.
That must have been so traumatic as a 10-year-old to see this disease, and then as you get older, you know that you may develop the same disease. And as you mentioned, you started passing out, having these episodes as a teenager. What did those look like?
I would just, my heart would begin to race a little bit, and then I would just pass out. And I just thought maybe it was because I wasn't feeling good, or, I didn't really know what it was. Got
it. And then you had your first seizure. When was that?
I was 27. I was hanging out with some friends. We were playing cards. And then my heart started feeling weird, and I started feeling faint, and then I passed out. And my friend said that a lot of I locked up and I seized out.
I have a question for Dr. Camarada on this one. She mentioned she had a grand mal seizure. Was that the grand mal seizure?
Yes.
Okay.
Yeah.
And what is a grand mal seizure for people who aren't familiar with seizure definitions?
Yeah, so a grand mal seizure is where you lose consciousness, and there's typically tonic-clonic contraction, meaning your arms and legs either stiffen up, that's the tonic phase, or extend and contract. And the harbinger is that you lose consciousness and you're out for usually a matter of seconds to minutes.
Mm-hmm. Boy, that must have been so alarming for everyone around Nerissa, too.
Yes.
So, Nerissa, you had to specifically tell a doctor that they needed to check for Moya Moya. This was long before Dr. Camarada. Did that first doctor listen?
Originally, the first doctor didn't really listen. There was a second doctor who, when I told her what needed to be done, she was like, let's get this done immediately. It seems like a very important thing to get done.
And when you said get this done, what were you meaning?
So an MRI with dye contrast is what it requires to be able to tell.
And this is where I want to bring Dr. Camarada back in. We know Moya Moya is extremely rare. People have to drive from all over just to be treated by you and your team. Is it a challenge to diagnose once someone presents the symptoms?
It's not terribly difficult to diagnose. The thing is you have to be aware of it. And it's an extremely rare disease. There may be 5,000 people in the United States with Moya Moya. It's very, very rare. And so you can't blame a pediatrician or an internist for not necessarily jumping, because certainly the cause of a seizure or a stroke is much less likely Moya Moya than it is something else.
Is it always hereditary?
No, actually, most of the time it's not hereditary, which is another interesting feature of Nerissa's. But if you do have a relative that has Moya Moya, you're probably 30 times more likely to have it. So it is something to think about. Yeah.
Okay. And do doctors know to even consider Moya Moya? If it's so rare, how would a doctor know to consider it?
Well, it occurs often in young people. I mean, Nerissa is in one age group. There's also a very specific pediatric age group, like children age 3 to 8 that present with strokes. That's extremely unusual. So whenever you see a young person with a stroke, it's got to be on the differential diagnosis.
Gosh, you hope it's diagnosed before the stroke, though.
Yes.
You know, thank God that Nerissa was diagnosed. I want you to help us understand what's happening in the brain's arteries when someone has Moya Moya, and we have some video and some images we want to show people. There's an image first of a healthy person's blood flow,
yes.
And that's
this is a healthy carotid arteriogram, a lateral arteriogram. So the skull is facing that way. The eyeball is over on the right-hand side of the screen, and what you see here, the large vessel is the carotid artery. It's being dye is shot up the carotid through a catheter that goes all the way up into the neck. And you see the dye coming in here, and it fills out the large blood vessels that proceed to fill out the rest of the brain.
So is this video or this series of images taken from someone getting the test to see if they have Moya Moya? And that's what Nerissa was talking about.
Well, they're getting this test to see if they have an aneurysm. Actually, this was someone that did not have an aneurysm, but this is sort of the definitive test that proves Moya Moya. But there are other tests, like the MRA she was talking about, that would lead you to suspect the Moya Moya.
And we have Nerissa's brain now. We want to show here, so let's pull that one up. Oh.
Yeah. So you see how exactly the cursor is showing the sort of pattern of puff of smoke, which is what Moya Moya means, I mentioned earlier,
so interesting.
In Japanese. And so they looked at this and they said, oh, it looks kind of smoky down there because we don't see all the usual blood vessels. So the carotid artery tends to just atrophy. And the brain, the body tries to create collateral blood flow, and that's what those little tiny vessels are down there, and it's not enough in many people, and they end up having either hemorrhage or stroke.
We have side by side now.
Yeah,
we have normal brain on the left side, or I should say typical, and then is atypical, that's Nerissa on the right, so you can see them side by side, so you can see that difference.
Typically, Moya Moya doesn't affect the posterior part of the brain as much, which is why you see those kind of normal appearing blood vessels there on the left side.
That is so interesting to see. And there are potential consequences of obviously restricted blood flow to the brain. Can you talk about that?
Yes, stroke is the most serious.
Right.
And stroke comes in two varieties. There's where the blood vessels, where you don't get enough blood to the brain and that portion of the brain dies. And then you can also have a hemorrhage. These little tiny blood vessels that the brain tries to create are fragile. And sometimes when someone has high blood pressure, those vessels can burst. And in some cases, young people like Nerissa will go to their physician, their blood pressure is really high, which is also very unusual. And naturally, they want to lower the blood pressure. Well, if you lower it too much, there's not enough blood getting to the brain. They can have strokes precipitated by treatment of the high blood pressure.
Oh, wow. So over the course of the past 20 years or so, I mean, you're on the cutting edge of this treatment. You're the premier expert in this. What advances have you seen to improve diagnosis and treatments?
Well, the diagnosis has been improved by CTA and MRA. I mean, since I started practicing neurosurgery over 30 years ago, we didn't have a lot of these techniques. We didn't have CTA.
Which is what we just saw.
Actually, we'll see a CTA in a moment, a 3D reconstruction of a CTA, but that was an arteriogram. That's what we had 30 years ago, but that requires, putting a catheter in the groin or the wrist, snaking that catheter all the way up into the brain, squirting dye. There's a slight risk of that procedure itself causing a stroke, and so that was the definitive diagnostic procedure, but now we have MRI, MRA, CTA, and CT perfusion, all these different modalities to help us discover that.
The treatment that Nerissa got was surgery. When does surgery make sense? Are there steps you have to clear and then you think, okay, is surgery the last resort?
Yes, so surgery involves one of multiple different procedures, but they all involve cutting open the skin, cutting open the skull, either laying down some tissue or making a direct connection between a blood vessel, which is risky. It does carry its own risk. The surgery does,
Right.
and you know,
Always,
Nerissa's mother died
and
after one of those
oh, wow.
one of those surgeries. Yeah. So it is risky. However, we know that untreated Moya Moya will proceed in all likelihood, and especially in young people, to strokes over a very short period of time. When I was young, when I was 30 years ago, we would see Moya Moya patients who were 50 or 60 years old who were demented and lost all cognitive faculties, paralyzed, I mean, because they had had so many strokes and there was no real cure.
We want to show our viewers the surgery. Now, this is where I want to give you an alert. You're about to see something super fascinating. It's close-up, in-focus video of Nerissa's actual brain surgery. It is graphic, so if you are a little bit squeamish, you might want to take note of that. Maybe just listen to this part. If you can watch, though, this is so interesting. Explain to us what you are doing to Nerissa during the surgery.
So this is just a, you see a tiny little clip down here that is closing one of the arteries on the surface of her brain. And we have a tiny little suture here. It's a nylon suture that we are suturing a blood vessel that comes from her scalp called the superficial temporal artery. And you see that blood vessel right there. And we're sewing it to the blood vessel on the surface of her brain.
Quick question. Yeah. First of all, Nerissa, is this the first time that you're seeing this video?
Yes. Yeah, it is.
What's it like to see your brain and you undergoing brain surgery?
It's definitely interesting, but
it sure is.
Yeah, it's you know, these are tiny little sutures.
How tiny? Because this is on a jumbo screen. So how tiny are those pinchers?
They're less than a millimeter. The blood vessel that we're suturing there is 1 millimeter in diameter, 1.2 millimeters.
So are these would be for people at home like little tweezers?
Yes, yeah, little tiny tweezers.
So these are the size of tweezers.
They're called jeweler's forceps. Jewelers use them, I'm sure, for handling jewels. And the suture is very small. It's hard to see with the naked eye. You can kind of hold it up in the light and see it.
So how are you seeing it when you're doing this?
Well, it's a microscope magnifying things quite high. And so we just put these sutures on each side, and then this is what it looks like afterwards. This is Nerissa's skull, reconstructed from a CTA. And you can see the one bypass vessel on the right, and there's the other one on the left.
And these
going
are
right
the holes?
Yeah, the little hole that we created.
So you put holes in either side of her skull?
Yeah, so it was a little oval cutout there, you can see, and that was replaced with those little plates. You can see titanium plates, but we leave a gap at the bottom for the blood vessel to come in and perfuse the inside of her brain. So it's bringing extra, it's like plumbing. We're just bringing blood from the outside in instead of trying to reconstruct the way it normally comes, which is up through the bottom of your skull.
Do you do plumbing at your house too?
No.
You hire an expert for that.
Yes,
you just stick to the simple things,
exactly.
The brain,
Simple
right?
plumbing.
Yes. That is wild. So where did you go in on Nerissa's? You went in through
over
those
here
little
on the
holes?
side. Yeah, so we make a skin incision, you know, a few inches long here on the side, over top of one of these arteries that is normally providing just blood to your scalp, but your scalp has so many collaterals from everywhere. You can take down one of those blood vessels, and we make the opening underneath the muscle here, your chewing muscle, right underneath that, open the covering of the brain, and then sew that blood vessel right onto one of the blood vessels on the surface of her brain.
So Nerissa, post-surgery, did you have the urge to feel your head?
Yeah, I did. Yeah.
Did you touch it, or were you told don't touch it? Do you have to wear a helmet or stay really still afterwards? What does that look like?
Just not to touch it very much, you know, because infection is one of the concerns that Dr. Camarada told me.
Right.
But the pressure, it was weird feeling that. It's hard to explain.
Now, is it all closed up now, or will she have...
It's all closed except for a little hole at the bottom. So
Right.
she'll have a little open area there, which is underneath her chewing muscle, which also hurts. She can tell you it hurt to chew. She probably couldn't eat a hamburger for several months after surgery because...
Just drinking things through a straw?
Yeah.
Were you allowed to do that?
Yes.
Nerissa, how long was this surgery? Or I should ask Dr. Camarada, how long is the surgery?
From start to finish, probably 4 hours, 4.5 hours. Maybe a little bit on the end, getting her to sleep and waking her up, but about 4 hours, I would say.
And does surgery cure Moya Moya?
So, no, not really. You still have that process that's resulting in the closure of the carotid arteries. We still don't know the etiology, what exactly causes it. But this provides extra blood flow so that by the time those carotid arteries have closed completely, she will have had enough collaterals from what we did and from other parts of the brain, from the plumbing, to keep her from having a whole lot more strokes. I see people occasionally that make it into their 60s and 70s who've had Moya Moya all their life and have had very few strokes. It does on occasion happen. Their brain developed enough collateral that they didn't need the surgical procedure.
And how many strokes did Nerissa have? Do you think, did she have a lot of mini strokes?
She had several small strokes that you could see on her MRI, yes.
Can you tell how many from looking at it?
You could. I don't know that I counted in her specific case, but yes, there were a number of them. Yeah.
Nerissa, how was the recovery from your brain surgery? What was that like?
It was kind of hard at first. Just not really being able to do much because I had to rest, and I'm a person I like to go.
Right.
So I had to be very patient, but everything healed up very well.
Were you in bed for a long time? Could you get up and do things around the house, or was this you're in bed for a few weeks?
I was in bed, but it was very important that I did get up and move around. So
got it. And now are you back to doing everything as you would normally? Can you exercise? Can you fly places, stuff like that?
Yes. I actually went on a trip to Florida. And,
wonderful.
I back to work. So, yeah, everything's normal again.
Did you start cosmetology school?
Not yet. Still a work in progress.
Okay, a work in progress is still work. You're headed that way. Have you ever met anyone else besides your mom that has Moya Moya?
I have not, but there is groups on Facebook that you can follow, and they give information on their, how they're dealing with their Moya Moya. Social
media can be terrible, and it can also be really nice for bringing people together when you have anything rare happening where you feel like no one else would understand it. Are you able to explain it to friends when you tell them you have this disease called Moya Moya? Yes. Yep. I can explain it pretty good, I think. Yeah. At least how mine went. Right. Well, we love getting our community questions, and we're getting quite a few. So please send in your questions to us. We are available in real time on Facebook, the X platform, YouTube. You can email the Medical News Network. We're going to read your questions. In fact, we have some coming in from viewers right now. Ruth Ellen has a question. She just wants to know if Dr. Camarada can explain, is this only treated by a neurologist?
It's treated by a neurosurgeon.
Neurosurgeon?
Yeah.
And only diagnosed by a neurologist?
Neurologists can diagnose it. Also, if a family doctor sent their patient for an MRA, they might get a readback that says, we suspect Moya Moya. So it could be diagnosed by anyone.
Georgianne writes, I knew of someone who has this disease. I'm interested very much. Best wishes to the beautiful young woman, Nerissa, and thank you for sharing. So it's a message for Nerissa. We have a question from Yen Liang. Yen wants to know, could patients with Moya Moya exercise? What kind of risks do they need to pay attention to? And what's the difference between Moya Moya disease and arteriovenous malformation? I don't know what arteriovenous malformation is.
So there are different diagnoses, and arteriovenous malformation, or AVM for short, is a blood vessel malformation of the brain. That's different than Moya Moya. And yes, they can and should exercise. You just have to be careful that your blood pressure doesn't drop too much during exercise if you have severe Moya Moya, because you need to get that, you have to have a certain elevated blood pressure to get blood perfusing the brain.
Melissa has a question. Melissa wants to know, if someone has Moya Moya but doesn't know it yet, What are the key signs to look for, and how do you test for it? We touched on this a little bit,
testing,
but let's
yeah.
reiterate.
And what to look for, you would look for something like Nerissa had, passing out episodes, seizures, stroke-like symptoms are certainly the most common, but oftentimes the first time you notice it or you are discovered to have Moya Moya, you have already had a stroke, a hemorrhage, or an ischemic stroke where the blood doesn't get to the brain well enough. So I would say if you're having stroke-like symptoms, check with your doctor.
Tina has a question. She wants to know if Nerissa might need any more surgeries, or is it done?
It's possible, although usually if she's had a couple of bypasses and they stay open and are perfusing her brain well like they are now, then she shouldn't need anything else.
Does every patient need 2 surgeries, one on each side?
Not necessarily. Sometimes Moya Moya only occurs on one side, called Moya Moya syndrome. And it can occur with several other diseases. It's more common in Down syndrome, sickle cell anemia, thalassemias, some other diseases. People who've had radiation at the base of their brain, same thing can happen to the carotids. Those are Moya Moya-like syndromes.
Interesting. I want to bring Nerissa and Dr. Camarada, both of you, back for today's takeaways. Dr. Camarada, what's the most important message that you want people to know who are watching right now?
I would say a young person with a stroke, keep this in the differential. Make sure that your doctor is aware that it might happen. It is extremely rare, but if you're a young person and you have stroke-like symptoms, something to keep in mind.
If you're a young person and you're passing out, or you have a seizure, is that something you should say, hey, check me for Moya Moya?
You should, again, because it is so rare,
Yeah.
it should be on the differential diagnosis, the list.
Got it.
And then to go to a center that has experience with it. There are a number of physicians, surgeons like me, all over the country that are trained to do this, but they're in specialized centers.
And we're here in the
go.
Midwest in
Exactly.
a giant health system.
Yes.
Nerissa, what would be your message for people watching?
Just to, if you think you have something, definitely push those doctors and just remain very positive throughout the whole thing. It's very hard, but I think, having a very positive mindset on everything helped me get through everything.
Nerissa, thank you so much. And I want to thank you again for sharing about your mom and us being able to see pictures of her and know what she was like. And again, you look just like your mom. It's really remarkable. So thank you for that. And we're really sorry for your loss of your mom. She looks beautiful. Thank you for sharing your journey. And thank you to our viewers for being with us today and joining the conversation. Dr. Camarada, thank you so much. Appreciate you taking time out of your day between seeing patients. We will see you again tomorrow right back here at 8 a.m.
Coming up tomorrow on the Morning Medical Update, work in the bag, breaking a sweat, and fending off Parkinson's disease. I'm Jessica Lovell on the next Morning Medical Update, Movement as Medicine. See what makes these kickboxing classes especially suited for movement disorders like Parkinson's, Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.